Hi everyone, thank you for joining us today. Can everyone hear me? Yeah, excellent. This is my first time hosting an Insight APSAD webinar, so thank you for your patience as I stumble a few bits. See, here we go through the introductions. But before we get started, I'd like to acknowledge the traditional owners and custodians of the lands and waterways throughout Australia and pay respect to elders past, present and emerging. I would also like to extend that to all of the Aboriginal and Torres Strait Islander people here in the room today and for those joining online across the country. We are hosting this webinar from Meanjin, Brisbane, and I'd like to acknowledge that we're on the lands of the Turrbal and Yagara peoples as well. My name is Karina Clarkson. I'm the Aboriginal and Torres Strait Islander Alcohol and Other Drug Workforce Education Coordinator here at Insight. I keep saying I'm new to the role, but it's getting closer to a year, so I think I have to stop saying that soon. Now I'd like to introduce our special guest, Associate Professor Michael Doyle. He is going to be talking about the development of a culturally based social and emotional wellbeing program for Aboriginal and Torres Strait Islander people in prison. I'll just give you a little bit of an intro to Michael. Michael's a proud Bardi man and has built a remarkable career in academia, particularly around Aboriginal and Torres Strait Islander health, with over 20 years of experience. His journey began as a health worker, working in remote communities where he's from across the West Kimberley of Western Australia, before transitioning into health research. Now Michael leads the Aboriginal team at the Edith Centre, which is based in Sydney, focusing on improving health services for Aboriginal and Torres Strait Islander people. During today's webinar, you're welcome to post some questions in the chat. And for those that are here in person, if you could just make a note of your questions, we'll have someone with a roaming mic at the end, and we'll save those questions for Michael at the end. And without further ado, here's Michael. Thanks, everyone.
Thank you, Karina, and thanks to Insight and APSAD for inviting me to come and give the seminar. I too would like to acknowledge, is that working now? Yep, cool, hang on. So that's the subject today, but I'd like to start by acknowledging the traditional owners of the lands we're meeting on today, the Turrbal and the Jagera peoples, who are the traditional custodians of these lands. And I extend those respects to all Aboriginal and Torres Strait Islander people who are with us or joining us online today, and as well as always elders past and present. So look, thank you very much. A little bit about the team first. So I'm presenting work. I feel like I supervise research these days. If I get a chance, I try to do research directly, but a lot of the data coding and the data collection, all of that have been done by my amazing team and led by Dr. Alison Evans. And then we've got Hannah Greger and Kai Clancy, and they've done a lot of the field work in this. So if you ask me really difficult in-depth questions, I'm going to have to ask these mob for answers, but hopefully I can answer most of your questions at the end of this as well. Yep. Good to know the recording's in progress. So a little bit more about me. So I'm a Bardi man, people from the Kimberley region. That's my community, Juddingen, up in the Kimberley region there. That's where I started as I was working in the store, and then my sister said, there's a poster at the office, maybe you should go do this Aboriginal health worker training. I thought, you beaut, I'll go into Broome and kind of have a party. And that was kind of honestly the reason why I enrolled, because it seemed like something different. And then, yeah, a little while later, I'm still working in health. So that was when I was about 20, I think, is how I got into health. I try to get back up there as often as I can. Yeah. So I should just explain the photo. There was my grandfather and his contemporaries, and that was taken on the islands off the mainland, off Bardi country, and so Bardi Jowl. And if you're on the mainland, you're Bardi, and then you're Jowl if you live on the islands. But we're like one nation. So Yeah, I won't go through all of those family photos, but I've been living in Sydney for about 14 years or so now. So overview of the presentation, I'm going to go through a bit of the background of why this is important. Because I think often it's very easy to look at the outcome of something without understanding what it is as the basis upon why these things are actually occurring. And then we'll look at the process of developing a culturally based social emotional wellbeing program for young people in prison, have a bit of a look at the scoping review, the aims and methods, findings, and the next steps. So it's been about 2 years since we had the referendum. This is still a really, really important document. I think every Australian should read this, the Uluru Statement from the Heart. And it does really eloquently highlight why this work's needed. And I'd ask you to, when you read this, draw your attention to this particular section, which says, proportionally, we are the most incarcerated people on the planet. We're not innately criminal people. Our children are aliened from their families at unprecedented rates. This is not because we have no love for them, and our youth languish in detention in obscene numbers. They should be our hope for the future. These are the dimensions of our crisis. These dimensions of our crisis tell plainly the structural nature of our problems. This is the torment of our powerlessness. Now that really sums up what we're seeing in the criminal justice system. So there may be reasons for which somebody might be imprisoned, but there are underlying factors that have exposed people to situations whereby things are more likely to occur. So if we think of intergenerational trauma, if we think about overcrowding with housing, with the way in which all these things have happened, these all are all factors that then contribute to what we're seeing, as well as, of course, the racism and sort of in-your-face sort of discrimination that is expressed sometimes through the criminal justice system. So we have this imprisonment rate, and this is the national rate for 2006 to 24 from the ABS, and we see this ever-increasing rate of imprisonment of Aboriginal and Torres Strait Islander people, and we see the non-Indigenous imprisonment rate remains very stagnant and very much the same. This trend can go back a bit further as well to pretty much when we started keeping this data in Australia. It continues to go upwards. We've had a couple of periods where it's remained fairly stagnant, but then it continues on upwards again. And we really do need to do something as a nation about this disgrace. And there are now targets for justice targets for Close the Gap. They're not on track. So how high this can go? Hopefully not too much higher, but there is still room to go on this. But as I said, this is telling two stories. Why is it the mainstream imprisonment has pretty much remained exactly the same while ours continues to increase? The rate of imprisonment and the numbers of imprisonment, I think when I presented this data many years ago, I was told you should actually break it down and also show us the numbers. So this is why I do this. So the rate is different in different jurisdictions. So each jurisdiction is responsible for its own criminal justice system. You can see there my home state of Western Australia has the highest rate of Indigenous imprisonment in the country, followed by the Northern Territory. Now, because of the population is different in different jurisdictions, Queensland and New South Wales have by far the largest populations of Aboriginal and Torres Strait Islander people. And so even though the rate is lower, Queensland has the largest number of Aboriginal and Torres Strait Islander people in custody. So if we think of the Northern Territory, it's a proportion of Aboriginal to non-Aboriginal people that might make it seem like there's a lot more Aboriginal people, but it's because there's less non-Aboriginal people in the Northern Territory is what's happening there. And so while there is absolutely a major issue in the Northern Territory, this is a national issue across all of the mainland jurisdictions. So I'd also sort of encourage people, sometimes when I use this data, we do a bit of a disparity Olympics or disadvantage Olympics and say my state's worse than yours, or we've got more. Everybody's pretty bad. So we should just argue collectively that all of this does need to change instead of pointing to one not being as bad as the other. The other thing with this, if you think of this as different criminal justice systems, if at a very minimum we were able to implement changes so that the rate of imprisonment in WA through to New South Wales, those other states, was the same as Victoria, you'd see a decrease in the number of Aboriginal Torres Strait Islander people in prison. So there are some very real things that could be done in a very immediate way. And it's getting the political will to get that done is a part of this. So my work looks at what can be done to support people who go into prison, but this is one part of the greater picture. And I've got lots of colleagues who work in justice reinvestment and people who work in towards stopping people having contact with the criminal justice system, and that's all really important work as well. But my part is more, what do we do when people do go inside? So looking at some of the what we see within prison. So this is from a report from the AIHW. I've done a bit of work on this report, as has Professor Megan Williams and Professor Jocelyn Jones. And so the three of us sort of work with AIHW on putting this report together. And what we see with some of the trends is that when it comes to substance use, in terms of alcohol, we see this is before prison use. So there's Aboriginal Torres Strait Islander people are more likely to have engaged in high risk, possibly dependent alcohol consumption to non-Indigenous and illicit drug use. You can see those differences. One of the challenges with the criminal justice system is everybody that goes to prison is in a pretty bad way. And I mentioned the sort of talking about disadvantage Olympics. The non-Aboriginal people who are in prison also don't have the best health if you compare them to the rest of the country. But in terms of an immediate sort of group, when we look at Aboriginal, non-Aboriginal within this system, that's what we look at. But I would argue that we need to do a lot better for everybody who's involved in the criminal justice system, people who go into prison. This is... it's hard to look at to get specific data on some things, but look, if we try to think of intergenerational factors and think about intergenerational trauma, for Aboriginal Torres Strait Islander people, about 1 in 2 in 5, or 36% of the people who are entering custody have had a parent who'd been in prison during their lifetime. That is really quite different, as you can see there, to non-Indigenous. And we look at the out-of-home care, so people who've been who have not grown up necessarily with their family, compared to 10% for non-Indigenous. And so we start to think about intergenerational factors that are happening with this data as well. And indeed, like during my PhD, there were two fellas who both had parents. Their dads had been to prison, and one of them had actually shared a cell with his dad, and he was really positive and said that was really good. I got to spend time with my dad. It's kind of I don't mean to be too judgmental, but it's kind of a bit sad as well. Like, if your time with your dad is sharing a cell with him while you're in prison. But this is the stories of what's kind of happening in our criminal justice system. And we really need to do a lot of work in this space and have a rethink about how this is impacting our communities. In terms of mental health, a lot more Aboriginal Torres Strait Islander people have been told by a health professional that they had some form of mental health condition, but still very high, 36% for non-Indigenous as well in that group. So people who go to prison generally have a history of alcohol and other drug use as a group. They've had some pretty rough background, particularly for Aboriginal Torres Strait Islander people. And a lot of people in that system also have some form of mental health or mental ill health, I should say. So So there's a real need to look at how do we work with these people when they're in site. And while my work had originally been about drug and alcohol treatment programs, where that research landed and the advice I got from elders and from community leaders was that, Michael, you can't just do drug and alcohol. You got to do social emotional wellbeing. And so I'm not a mental health person myself by any means. That's not my background or my training. I don't think I've ever published a paper in mental health. But we need to look at drug and alcohol as more a symptom rather than the cause, and look at the overall sort of well-being. And that's where I put together a grant. We put that together. Karina was fantastic in helping, being an investigator on that as well. And then we were successful, and we went ahead and started developing this program. So in terms of the aims and the methods, so governance is incredibly important for Aboriginal and Torres Strait Islander research. And so it's an Aboriginal-led study. Majority of the chief investigators are Aboriginal and Torres Strait Islander, and we have regular project meetings, of course. We have the reference group through the Edith Collins Centre, which is where I'm based, and then we've got ethics approval from the AHMRC and also from YHEC. So it's only been undertaken in those two states, but we did go through the Aboriginal ethics committees in both states, and we do have ethics from Justice, Health and corrective services in both states, but for me it was important getting the Aboriginal ethics, of course. So the overall aim is to understand how cultural practices are currently used and the part of therapeutic programs in communities, so we can use this knowledge to inform programs in prison and inform the development of a program. So we went out and interviewed drug and alcohol workers in the community and sort of used that knowledge to inform the development of a prison-based program. Using a sort of a yarning method, which is a very natural sort of conversational method. Karina, I'm sure, can talk to you about what yarning method actually is. But Dawn Bezerup is, if you have a look at her paper on yarning method, it explains it incredibly well. And that's the methodology we're using. We've had an Aboriginal lens applied throughout the entire project. So the scoping review, we're writing this up at the moment. So this was an international sort of bit of work. We did a grey literature search in Australia, Aotearoa or New Zealand, Canada, and we did a bit of a grey literature search in the USA, but we could only do that at the national level. It's a bit hard to scan data at all 50-odd jurisdictional levels. In Canada, we did go to each province, so it's a bit more detailed. And New Zealand has one system for the country. They don't have different states. So we got a lot of data from those places, and we found there were 75 programs that were Aboriginal. Well, this isn't just Aboriginal, of course. So we're First Nations focused that were being operated in prisons that we could find information about. There may be more out there. There probably are, but these are the ones we can find some information on. 65 were Indigenous specific, and 6 of them were like multicultural, or bicultural, I think. And I think some of those are from Aotearoa, where you kind of have Pakeha, or white people, and Māori. And so they were sort of, some of those programs are what they call sort of bicultural, I think. I hope I'm using the right terminology with that. We'll find out in a few weeks when we have our Māori colleagues visiting us in Sydney. So mainly targeting men. Men are 90% or 89% of the prison population when it comes to us. So most of the programs we found were more for men. There needs to be a lot more work with women, of course. But in some ways it's sort of understandable if 90%, so 40 out of the 75 programs were for men specifically. Traditional cultural education plus Western models was quite common between with these programs. So using a bit of CBT with cultural knowledge. There were some programs that were specifically just cultural as well. So as I said, we'll publish some of these results hopefully in the next 6 months or so. Fingers crossed. It takes a while to get this stuff published. group setting or additional one-to-one counselling. So these were all group programs, of course, that's what we went to look for, but some of them also had one-to-one counselling components as well. Facilitated or co-led by Indigenous people. So each of these were completely Aboriginal or completely First Nations facilitated or had co-leads. A couple of them had co-facilitation with people who are in custody, or inmates, if you like, co-facilitating the program, and that's a model we're kind of looking at as we move forward as well. And outcomes were more measuring behavioural change and improved SEWB. So measuring social emotional wellbeing changes is actually quite difficult, and you need the right sort of culturally informed tools to be able to do that. That's something we have to consider as we go forward as well. So measuring outcomes based upon reincarceration is a really blunt measure, and it doesn't tell the whole story. So I won't go into that, why it's not the best measure, but it's the most commonly used measure. So interviews with health professionals. So presenting on two of the research questions, so one of them was how are cultural practices used as part of these therapeutic programs in the community? And then how did you use those knowledges or how could this knowledge inform the development of culturally based social emotional wellbeing program for young people in prison? So this is a summary of the participants. So we went Broome, of course, Perth, Sydney, and then the Central Coast. So we found from this, these were the main key themes. I'm going to, the next few slides sort of breaks this down a bit further, but client-led approaches, space and culture, space and structure, trust and rapport, strengths-based activities, and cultural principles. There is more data than this, just presenting a snapshot today. So client-led approaches. So what we found was that the approaches really had to be client-led. So if somebody comes into you and you say, well, your main drug of concern is amphetamines, and we're now going to do something about your amphetamine use. So that was a way in which to sort of disengage with the client, shall we put it nicely. But if the client comes in and you just have a yarn and you talk about what do you think you want to do, and then coming up with priorities of how the client, what the client wanted to do, was the best way to move forward. Strategies needed to overcome during these sessions issues related to alcohol and other drugs and trauma, of course. So most of the people we interviewed were drug and alcohol workers, but trauma was always a major present factor within all of these interviews, and working out how you can work around those matters. As somebody said to me the other day, trauma casts a very, very long shadow. And so working in a trauma-informed way was critical when developing a client-led approach. I won't read all of the quotes, I'll just let you read through that if you like. That's, of course, a pseudonym. So in terms of space and structure, so client-led approach to picking the environment. So some people are perfectly happy to meet down at the office. Other people just wanted to go for a walk. And sometimes people would like to have a different kind of venue. This isn't always, of course, possible in a prison environment, but it comes back to speak towards when designing the program, the actual physical environment within which a prison-based program is operated becomes incredibly important to working out how that all fits in with developing or delivering such a program. Settings. So yeah, as I sort of said, custodial settings, rules and regulations. So this is incredibly important within a community setting. And I've kind of covered a bit of that, but natural light was a big thing when people were sort of saying about if you've got doing counselling, and having visible symbols of seeing that Aboriginal people are welcome in places is one of those things. Having artwork, those kinds of things, you kind of look for that when you go in places. I don't know if anybody else does, but you go to an office building or anything and you do notice whether there is Aboriginal artwork or not, and it just clocks immediately. So all of these things came through with the interviews. Building trust and rapport. So a significant amount of time is getting time spent getting to know the client. So I did do a couple of the interviews, and one of the things was doing the intake form shouldn't be the priority on the first day you see them, because often that just dominates the entire thing. So maybe the first time you don't necessarily talk too much about the intake form and say, we've got to do one, but why don't we do that next time? And then why don't we just have a yarn today as the first session? And so in developing what we're doing, it's like, well, perhaps the first session is just about yarning, and then at the end of that we say, well, in the next session we're going to do something about X, Y, and Z and da-da-da, but we'll talk about that more next week. Today was just about getting to know you. Clients appreciated lived experience of substance use and incarceration from health workers. So if you were somebody that had been to prison, been inside, having the workers said that their clients really appreciated that. Not necessarily whether you yourself had been in, but if you had family members or had some kind of connection, some kind of understanding of what it's all about, rather than it just being sort of a more theoretical academic experience. So that lived experience was incredibly important. This, of course, is the case for almost every Aboriginal Torres Strait Islander person. I have not yet met a single Aboriginal person who is not affected in some way by the criminal justice system, which is pretty sad. But so we kind of all have a bit of lived experience we can share with this space, unfortunately. And sharing about life within professional boundaries. So the difficulty within prison is that you do get specific guidelines about what you can and can't say to clients. Like if you're doing a drug and out, you're not really meant to say much. That can be a real problem. But what we found when we did the interviews, people saying you have to kind of just say a bit about where you're from or where you grew up and build that rapport. It's just kind of natural. Particularly for Aboriginal Torres Strait Islander people, you just share about where your family's from and then you kind of build a connection. That will probably be a bit of a challenge once we move to more an operational stage, but it did come through as being incredibly important. So we've got Emma, who's saying a few things there. So strengths-based activities was something that came through. So talking about, the different services we went to talked about sort of how do we do healing programs, how do we support people post-release. So these, as I sort of said, these were community-based interviews, but we did want to interview people who had done work, people who had been to prison. So this comes through quite strongly as the post-release support element of this bit of work as well. And focusing on the client's strengths and achievements. Now, I don't know, I mean, at the university, it's like so hierarchical that people will ask you straight away whether you got a PhD. And if you haven't got a PhD, then, oh, well, who are you? I mean, that's kind of how it goes sometimes if you're an academic. But the reality is, if you've finished a barista course, that could be absolutely fucking awesome for somebody. like that could be the really, really big achievement. So getting an achievement or something that's based upon where you're at and recognizing that not in comparison to oh well, such and such has done this and you've done not much. So strength based and acknowledging those achievements. Part of this is also about a very Western white male way of operating, where you introduce yourself and you ask, well, what do you do? That's a real white man question. Sorry for the white men in the audience, and it immediately sets up a hierarchy where for Aboriginal men or Aboriginal people, Torres Strait Islander people, we often be like, "Oh, where are you from?" and "Who are your mob?" And then you might eventually say, "Oh, so what do you do?" But that's not the important thing. The important thing is just saying hello, and so we have this thing of working out if somebody has a job. And then you immediately think, oh, that fella's a professor, he probably earns more than me, or that person's a mechanic or something. Like you have this hierarchy sets up straight away. So focusing on the client's strengths and their achievements, so asking what they do immediately might not be the best question at all. Examples of stuff. So we've got sort of talking about skills in transitioning from prison to AOD treatment and back into the community. Secure housing. We are in a housing crisis, and it's somewhat, not just somewhat, it's incredibly ironic that Aboriginal and Torres Strait Islander people are some of the most affected people in terms of secure housing in this country. Parenting and support. So a lot of people have responsibilities for family and that kind of thing. Uncling and auntying responsibilities are incredibly important for Aboriginal and Torres Strait Islander people as well. So not just having children yourself, you can have significant responsibilities. I know what that's like as well, and every Aboriginal Torres Strait Islander person knows what that's like as well. And cultural connection and talking to people about language, sort of music, those kinds of things. Some people might not necessarily, they might know where they're from, but they may not have been there as well. So it's also important to not press on that issue. And some people kind of know they're Aboriginal if they're sort of intergenerational, they're members of the stolen generation, but they don't necessarily know much about their nation. So it's a way in which, how do you gently guide through some of those conversations as well in a respectful way. Music is always a good thing though. So some of the cultural principles. So found that Aboriginal-led facilitation would be the best way, or Aboriginal and Torres Strait Islander, I should say. We are in Queensland, so I'll definitely I have to think about these slides next time. Probably be in the feedback, I imagine. So non-judgmental environment was one of the other things. We talked a lot about environment. Having some food, tea, coffee while having a yarn. Doing cultural activities while yarning. If I recall correctly, one of the women we interviewed, she kind of does weaving, like basket weaving, and she found that incredibly helpful. Like she'd just be weaving stuff and the client would just start weaving stuff as well. And so that was really, really helpful. So doing stuff while having the yarn as well is incredibly important. Yeah, and there's other cultural activities, of course. So key findings from question 2, connection to culture, spirit, and the dreaming. So presenting a couple of bits from this, personal and family health, education and behaviour change, cultural activities and practical considerations for a prison-based program. So personal and family health is physical and mental health, and talking about more holistically with the individual. So around working with the family, intimate partner relationships and parenting. So sometimes discussion around parenting, this has come through in other data, so I'm kind of leaning on another thing, but some of, if you've been in custody a lot, you may not have necessarily, and if your dad had been in prison and there's this intergenerational issue going on, supporting people with family relations and parenting and learning how to do those things can be a really important factor within this work as well. Having family-friendly programs and talking with about the whole family. probably don't need to talk to this particular audience too much about that. It's probably something you're all talking to Queensland government about needing to do more of. And maybe talk to Karina a bit about that. I'm sure Karina will sort of talk about some of those things. Family-led decision-making, of course. So for some people, they're very individually based, but sometimes it's good to make decisions based on the whole family and working through as a family group rather than the individual. And talking about family and domestic violence issues and working through some of those. Some of what we're finding is, particularly for men, it's perhaps not the best way to lead a conversation to immediately start talking about sort of family violence and stuff. So you might want to talk about those things a bit later after you've established a relationship, because it can kind of tune people out. And so while I'm saying we shouldn't sort of avoid having a conversation with men about those things, often the conversations led from a perspective of men are being violent towards women. But if you lead with men are violent towards women in a conversation with men, it doesn't necessarily get the men too involved immediately. So maybe better talking about these issues more generally. I hope I'm explaining that well, but you want to get people engaged is probably the first part of that conversation, rather than the sort of heavy end of who's doing what and all of those things, and putting all those judgments in. The other thing we found in this project is almost all of the resources developed around interpersonal violence have a very particular portrayal of men and women. Not everybody. I'm a gay man. My partner is male. But if your partner is not of the opposite sex, those resources do not talk to you. And it's perhaps not every single situation where those things are played out. So more gender neutral material may be something that's needed into the future. Education and behavioural change, education and day-to-day living skills. This was something that came through as being a big thing of what clients wanted to talk about, and this comes through in a number of different bits of work as well. So building on basic living skills, saying that, oh, look, it's all online, just go and find it. Well, that doesn't mean much if you can't use a computer or you don't have access to the computer. So you may need to so part of what we do, and we haven't done this in this first block of 10 lessons we've developed, but as we move forward, we'll develop more sessions that will incorporate some of the day-to-day living skills, but being able to work out how to do some of this stuff is incredibly important. So not just saying use a computer, but this is how you use a computer, or these are the sort of steps, and go get your identity documents, or these are the places you need to go to do those things. And budgeting is an important thing as well. So could go into that, but providing explanation and giving people a practical demonstration is what may be needed. So AOD harm reduction, I won't talk too much about that, but talking about how you can reduce harms from alcohol and other drugs, which is the core stuff of what Insight do. So we've got a quote from Trent there. So in terms of the cultural activities, the most discussed, we're talking about doing yarning circles and learning on country. So taking people out and doing stuff on country. Song and dance were part of it. One of the guys we interviewed, he had he had been in custody, and during that time he'd sort of used clap sticks and stuff, and it's some really traditional kind of stuff he'd done with the other fellows inside, and people were they were really engaged. So these were some of the main activities. I won't go into this too much. Kai's kind of been looking after this section of the project, so ask him for more details on that. Followed by sort of hunting, fishing and cooking. So hunting and fishing were where there was an issue more and more, I guess, is where the family had the resources to be able to do these things. So in Broome, this came up a bit in other places. So you may not have the resources to be able to get in the car and go out fishing or go out hunting. But where they did, these were very, very good things. And these were things that came through from these interviews as stuff that people wanted to do, but today they're less able to do, and cooking as well. And so within what we did with developing the program in the prison, there's some stuff with cooking we can do and some we can't, depending on which level of security it is as well. So there are a number of sort of more traditional activities that came through with this as well. So practical considerations. We found that sometimes having proper funding was a real constraint with doing these things. This will come through for us as well. Pilot funding isn't that stable, of course. So having sort of longer term contracts to be able to plan is a really important thing. For having more First Nations staff. Connecting with rehabs, so the drug and alcohol workers. There were a couple from rehabs, but there were some who weren't working in the rehabs, and so the referral process for people who come out of custody, who are seeing them, getting them into rehabs, was not working necessarily that well. And it's just this ongoing issue that happens all the time. Where we land with it, I don't know, but it'll be an issue with people. It is an issue with people coming out of custody as well. They said that we should have a sort of a shirt or something, clothing tied to the program will be a good thing for us when we go forward, because these organisations all had those things, and that was a good thing for them. What we found was the cultural activities, the recommendations we got from the AOD workers was you should base it upon the traditional owners of where the prison is located, rather than trying to cater for everybody who's there, because prisons have people from all over the country. So if it was say a prison in Perth, it would be based on Whadjuk Noongar, because that's the local nation, and then people could do other stuff, but the first point should be trying to base activities. And so going forward from where we're at, we are developing the program so that you would have activities that were specific to each of those sort of areas where the prisons are. So the program would be adaptable. It wouldn't be something where everybody has to do stuff that Koori Mob do in Sydney because that's where the program got developed. That's not how this will work into the future. Flexible format to suit prison security levels, and this is something that we're still moving forward with. So, and there's one more dot point there. How cool's that? So program participation by Indigenous and non-Indigenous clients. Now, this was a really important thing that did come up, and it's come up through through the scoping review as well. So with our Aboriginal drug and alcohol services, if you don't have to be Aboriginal to attend those services, but you'd normally have to, your partner, you'd have to be a member, be family basically. So my dad, he's white, he can go to the Aboriginal Medical Service. They're perfectly happy for that because his children are Aboriginal. And so that's in the community setting. We have non-Aboriginal people coming to our services, of course. There are some people who grew up with Aboriginal families, Aboriginal and Torres Strait Islander families. They feel more comfortable with our services. And so in terms of in prison, this is also the case. So we may have people who want to do the program who aren't Aboriginal, and we should be prepared for them to do the program as well, because they may have Aboriginal children or Aboriginal family, and yeah, so being open for that was another part of what we found had to be practical consideration. So we've got Dennis there. There you go. You're pleased to know I'm almost done, and I've gone a little bit longer than I expected, which I tend to do. So look, in summary, client-led approaches to understand and heal underlying causes of alcohol or other drug use issues. So talking about that a bit earlier. Relationships, trust and trust building are key. Importance of connecting to culture, family, community, spirituality and emotions. And so there's implications for further research to understand from an inmate's perspective what they want to learn. Some of that I did in my PhD. There's still more that we would need to do with this program as well. The next steps, we have developed the lesson plans. I'll show you that shortly. Currently undertaking a Delphi study. I think that's just about completed now. And that's having a look at what those lesson plans look like and how practical they are for implementation. We want to have like a yarning circle to focus test. This will be in a community setting rather than in prison, but we want to then do that within a prison setting as well. And we'd be looking to pilot what we've developed towards the end of 2026 or 2027. I understand Queensland Corrective Services are here. Hint, hint, possibly we could have a yarn with you if we could do a pilot up here, but resources are always sort of a thing as well. So this is what we've developed. This is from a few weeks back. This has slightly changed some of the headings, but that's we now have a full sort of program developed, and this has been tested through a Delphi study. So there are 10 sessions. We have several others, including sort of stuff around sort of day-to-day living and things like that. But this is the sort of core sort of starting point. So the vision would be that would end up maybe 20 sessions. And that each of these sessions would be standalone. So it would be suitable for people who are on remand. Often people on remand do not get programs. They're meant to, but it doesn't always happen. But it's like, because you can't enroll in a 10-session program if we don't know how long you're going to be here for. But you could do any individual one of these is how we want to structure this into the future. So just to acknowledge the team, the chief investigators, amazing group of people, associate investigators as well. Should see Karina's name on there. If not, I'm going to be in trouble. Oh yeah, there you go. Karina Clarkson, excellent. And then they're our main partners as well, and the project team. So that's me. And this is funded through an MRFF Indigenous funding grant. Okay, thank you. 10 minutes, I talked too much.
Thanks, Michael, for a really great presentation. We might start with questions in the room. We might do 1 or 2 questions from the room, and if we've got time, 1 or 2 questions from online. Does anyone in the room have any questions? We've got Brett with the roaming mic. Thank you.
Talk about young Aboriginal and Torres Strait Islander people in prison here. We talk about young people who are above 18 or under 18 because that's a really different landscape that we're talking about. When we have young people that are held in youth detention centres, a lot of the I guess findings from the study might not be as applicable to young people in youth detention centre compared to younger people in adult prisons.
Yeah, excellent. Yeah, so the terminology in the grant was because of the grant round. So this is 18 to 24 years of age. I defined that as young people, and my work has been in the adult system. So you're absolutely correct, of course, as a juvenile is somewhat different. I would though say that the landscape is different, but not entirely incompatible. So we can sort of say, well, this won't work for young people, or in juvenile custody, this will work better in the adult system. There are, of course, things that are very much in that category, but there are also factors within that. So if you've grown up in a pretty difficult life circumstances, unfortunately, a lot of the people who are in juvenile custody, the data shows us for Aboriginal and Torres Strait Islander people that they will end up going into adult prison. That's very sad, but that's pretty much what's happening. And so it's a very similar population of people, just at different stages, unfortunately. So I get what you mean. And yeah, there is a difference. Ideally, we would like to move to doing a similar project, but specifically for the juvenile. Does that cover that? Yep, cool, thank you.
I think that was a really interesting presentation. My name's Josephine. I work for the Mental Health, Alcohol and Drugs Strategy and Planning Branch. One of the tensions that we have is between the delivery of something that's a health program as opposed to a cultural program, and the responsibility between the agencies to deliver what aspects. How have you dealt with that tension?
Look, we've kind of ignored it in some ways. So the structures of the two departments. So Queensland Health isn't the service provider within the prisons. Am I correct with that?
We provide the health services.
Oh, okay. Oh, yeah. Yeah, because WA the Department of Justice is both the health service provider as well as the custodial, and so some jurisdictions have changed. Victoria is you've got Justice Health, but it is actually part of the Department of Justice in Victoria, and so that separation between departments is not. We've got a different picture in different jurisdictions. Look, it would be great if we saw that as more a challenge for the bureaucrats rather than the actual clients, if you get what I mean, because they're not necessarily thinking of these things as this is completely separate and different. But it's the way in which the health system operates. I can't really give you a good answer to that. It's an ongoing challenge. So yeah. What the PhD, this is years ago I did that, but the fellows were very aware that the facilitators of the drug and alcohol treatment programs were employees of corrective services. They were very aware of that. And they were very, very aware that when they spoke to the nurse at the clinic, they were a New South Wales Health employee, and that was a different conversation. And so there may be more work needed to understand how the client group themselves feel about who's best positioned, because they kind of know who people are getting paid from. And that to them makes a difference in their mind. And they may be less likely to talk about, I've been injecting drugs for the last 10 years, if that person works for Corrective Services Queensland, than if that person worked for Queensland Health. Just theory, but that, well, kind of not just theory, I guess that's what I was told 10 years ago. So,
contrast comparisons to discussion.
Oh,
What's the difference between
Yeah, so the development of the program didn't do a comparison between jurisdictions. That wasn't the point of it. It was to work out why people are doing things in the community-based setting, and then to use that to inform the program. The program's also informed by, we've tried to get all the programs from around the world as well, and there's 70 odd of those, and reading through those, and that's how we've come together to piece the thing together. What you're talking about will exactly be part of what happens going into the future. So when we move towards doing a pilot, we would then be able to say, well, this is the challenges in this jurisdiction compared to that jurisdiction. The question I get asked that's a little bit more tricky in terms of this, and I'll name it, is the difference between those different sites. And I honestly went for Millie-Ramara up in Broome because that's kind of where I'm from, and that's where I know people up there. So there is a difference in some of the data that's come back, because if we're talking about the Kimberley, we're talking about people with far more remote experiences compared to in metropolitan Sydney or Perth, for that matter. So that's been a bit of a challenge. But there's a lot of similarities and crossovers with that as well. But it's been enough for us to be able to piece together a program.
Hi, my question kind of comes back to what Joe was saying. So I'm Michelle Cromber. I'm the manager for First Nations in the same branch as Joe here for Queensland Health. When you mentioned before needing to have flexible delivery options according to security levels and whatever's happening in the facilities at the time, did you find anything, or would you recommend anything for us in Queensland for dealing with that issue? May come back to that whole conversation we just had about who's actually in charge of the service delivery, because we find there is a bit of a tension between both prisoner health, our delivery of mental health and addiction services, and then also the broader corrections way of operating. So you might not be able to help us. If you have any suggestions, we're happy to hear them.
I'm very aware of some of this. So that came through from a number of sources where that's presented on there. So it's kind of so what can I say about talking about the cooking stuff? Well, there's stuff we could do in a minimum security that you're just not going to do in a medium or max. And New South Wales prison security classification is that you've got like two classifications for minimum, 2 medium, 2 max, and then you've got super max. So there's like 7 classifications, not just 3. And I think Queensland might be a bit similar. Don't know who's online, but egos are a big issue. Let's just say that, and people wanting to own a particular space, and the departmental cultures can be a challenge as well. And these are all things that are not necessarily helpful for the people who are inside at all. But they are real issues that anybody who's wanting to do work in the space has to come across. So I don't have an answer for you, but we talk about departmental culture and change, and often some of that conversation is focused on changing the culture of Aboriginal organisations. Well, there are government departments that need serious cultural change and review. And I don't want to beat Corrective Services New South Wales up too much, but you can't miss it that there's a portrait of the king at the entrance to prisons. So they've replaced the portrait of the Queen. But when you go into a prison, there's a portrait of the king. And it's a department that also says that they are the oldest government department in the country. And they are. Established in 1788. So that's the line of that government department. So these are old government departments as well. And if the wrong people are listening, they'll be like, oh, we're not letting that fella anywhere near us. But I think we have to be able to honestly have those conversations and say these things and not be fearful that if I want to try and help our team and help our mob and we do this program, that because I've said something that's a little bit controversial, they're going to be like, no, you can't come and do that in our prison. But these are real things about decolonisation of this country if we're going to get serious about that. I think I've gone over time now. Thank you. It doesn't answer that, but I'm with you on the challenge. Right.
We'll yarn a bit more offline as well for those that are here in person. We have a few questions online. I'm just going to probably read out one because we try and keep things to an hour.
And I talked too much, Karina.
That's okay. There was one question. Some of the questions were relevant in the context that the program was already in practice, although it's currently under development, and you talked about it being piloted in 26 and 27. So they're probably a little bit early to be asking some of the questions, but someone, which was interesting, Michael, because we were talking about this in a different context before the webinar started, it was, have there been any comments about power imbalances being a barrier in these programs between client clinician? And we talked about it from a systemic level. I think with the questions that Josephine and Michelle asked, has that kind of, did any of that come up in the context of support that's provided or currently provided? And has that been considered?
It wouldn't. I would need to ask Alison, who's been more day-to-day doing the data. So I can give you a kind of an answer. It wasn't a specific consideration, but I would say that part of the, if you think more deeply about some of the other data, when you talk to somebody with lived experience, that is often a conversation that levelizes a power imbalance. So if somebody's had experience of those very things, then you're much more on a level field. So it's sort of an equalizer. So different ways in which power imbalances can be overcome is probably in there, but we hadn't specifically thought about that question.
I think one of the quotes that was taken from one of the people that were interviewed talked about the importance of kind of having that lived experience sort of presentation, because it kind of, I think it can level some of those power imbalances because it can make that connection and experience a bit more relatable. I don't know, just thinking out loud. But
it does, yeah, for sure. Yeah, and we were literally talking about power imbalance in relationships and
an hour and 10 minutes ago.
an hour and 10 minutes ago. And often people don't realise how much power they can have in a situation is part of what we're saying. And so power imbalance is a big issue.
Yeah. Lots more questions. Sorry, we don't have time to get to them today. Thank you to everyone that's joined online, and for those of you that were able to make it in person. I don't know if I really need to sum up what Michael's presented. I feel like the questions have kind of done that for us, but really looking forward to, subjectively, I'm an associate investigator on the project, so I am familiar with the program, looking forward to it being piloted and seeing the results of how that's been adapted in different jurisdictions, particularly in the context of some of those cultural considerations, and also in those metropolitan versus regional and remote settings as well. It'll be interesting to see how that plays out in practice. But can we just all thank Michael for joining us, and we'll see you back soon.